నమస్తే. వెల్కమ్ టు సుమన్ టీవీ. వెన్నెముకకు సంబంధించి చాలా రకాల సమస్యలే ఉంటాయి. లైక్ స్పాండిలైటిస్, స్పాండిలోసిస్, సయాటికా ప్రాబ్లమ్, డిస్క్ బల్జ్, స్కోలియోసిస్ ఇలా చెప్పుకుంటూ పోతే చాలా రకాల సమస్యలు ఉంటాయి. అయితే ఈ సమస్యలన్నిటికీ కూడా ఎటువంటి చికిత్సా విధానాలు ప్రస్తుతం మనకు అందుబాటులో ఉన్నాయి? సో, వెన్నెముక సర్జరీ అంటేనే చాలామంది భయపడుతూ ఉంటారు. సో, భయపడాల్సిన అవసరం లేకుండా నౌఎడేస్ ఎంత మంచి టెక్నాలజీ ఇప్పుడు మనకి ఇంప్రూవ్ అయింది. సో, ఎలాంటి చికిత్సా విధానాలొచ్చేసాయి. ఈ విషయాలన్నీ కూడా తెలియజేసేందుకు మనతో పాటు ఉన్నారు స్పైన్ సర్జన్ డాక్టర్ రాఘవేంద్ర గారు ఫ్రమ్ కిమ్స్ హాస్పిటల్ గచ్చిబౌలి. హలో సార్.
నమస్తే మేడం.
సార్, జనరల్లీ స్పైన్‌కి సంబంధించి ఎలాంటి ఇష్యూస్ ఫేస్ చేస్తూ ఉంటారు? కొంచెం క్లుప్తంగా కావాలి మాకు.
So nowadays, spine issue అనేది it is a very common problem. Day to day, if you look at the worldwide stats, 1 in 4th will go for a consultation of 1 hour in his lifetime, a back pain or a neck pain.
Yeah.
Because of our modernization, whatever we are working with the system and all those things, the day by day spine problems are increasing one or other day. In this one.
Exactly.
And earlier, when we were in our education or school days, the spine problems were more common once we are 40 plus. But as an increasing trend now, we are seeing even the spine problems even at the age of 15. Okay, so it may be because of their excessive use of gadgets and not using your physical exercises lekunda. So this all the maybe the reasons for the spine issues in increasing. It has been said that every fourth, 1 in 4th will have one or other spine issues in his lifetime.
సో ఏజ్ వైజ్‌గా చూసుకునేటప్పుడు, ఏజ్ గ్రూప్ వైజ్‌గా చూసుకుంటే ఎలాంటి ఇష్యూస్ తోటి మాక్సిమం వస్తూ ఉంటారు? సో నెక్ నుంచి మనకి లుంబార్ వరకు చూసుకుంటే ఎలాంటి ఇష్యూస్ ఉంటాయి?
So generally what happens is God has given us basic wonderful spine for us to walk. Basically మనం బాడీ వెయిట్ అంతా స్పైన్ మీద పడుతుంది. సో ఇఫ్ యూ లుక్ బ్యాక్ టు ద ఎవల్యూషన్, మాకు జంతువులకి తేడా ఏముంటుంది అంటే జంతువులు 4 కాళ్ళ మీద నడుస్తుంది, స్పైన్ మీద అంత బరువు లేదు. సో బట్ వీ హ్యూమన్ ఓవర్ అన్ ఎవల్యూషన్ ఫ్రమ్ 4 to 2 legs. So somebody has to take the responsibility to bear the weight. So spine takes the entire responsibility of bearing the weight. So in that what happens, I want to show this one. We have a spine, madam. This is we call a vertebral column. So if you take from top to the bottom of the vertebral column, God has made in a 33 bones ఉంటుంది దాంట్లో. దాంట్లో ఏమంటే మెడలో ఒక 7 bones, చెస్ట్లో ఒక 12 bones, కింద 5 bones. సో ఏమవుతుందంటే జనరలీ ఇన్ డే టు డే ప్రాక్టీస్ వాట్ వీఆర్ టాకింగ్ అబౌట్ ది స్పైన్ ఇష్యూస్ అనేది is basically degenerative problems. Means as we advance, as age advances, what the changes will also happen. As we get older, the gray hairs, even spine also, some or other forms get gray in color. So all this pain in the back pain or the neck pain, all these are manifestation of the aging. It's called degenerative process.
సో స్పైన్ ఇష్యూస్ అన్నిటికీ కూడా సర్జరీ అనేది నెసెసిటీ ఉంటుందా సార్? వితౌట్ సర్జరీ కూడా మనం దేన్ని ట్రీట్ చేయడానికి అవకాశం ఉంటుంది?
No, basically before surgery anedi, it is a last and a radical step for any spine issues, because 90% to or 95% of the patient who come to our OPD, most of them they will have a muscular, means muscle issues rather than a spine issues. Example, you take a neck pain or a back pain, the more muscle spasms are the most prominent things which the patient will. So you generally don't need a surgery, is a very last procedure. So as I told you, out of 100 only 1 to 5% of the people may require surgery. So before I explain about the surgery, I like to tell how the patients will come to us, whom we investigate, whom we don't investigate. All are important to understand. If a patient, with example, mostly we are talking about the degenerative, as I told you, it is basically of our lifestyle habits which has caused this problem. Okay, we used to tell our patient like nowadays sitting is more dangerous than smoking. Okay, so that is the thing. Generally what happens is the people come to us with a neck pain, or they come with like an hand pain. Okay, so we sometimes, if you talk more about the back pain, which is a little more common than the neck pain, they will have a back pain, the lower back pain, and they also have that radicular pain we call, means the entire leg, one leg may be paining, or it may be two, or sometimes they will have tingling, madhubarnam antamu, timmarlu pattadamu, joom pattadamu. This is a common words what we learn, you see from the patients, that we call paresthesias. And the extreme form of the patients, what happens is they go with urine retention. That is their extreme symptoms. We don't find those day-to-day basis symptoms. Okay, something we call them as a red flag signs, we call them, like an early morning pain, and back pain is so severe, not responding to any medical therapy, and leg pain is so severe, and any tingling sensations. This all the signs of a severe compressions is happening, which we have to under investigate, so that your investigation should be begin very early, so that before complications happen. So to happen, what investigations we do most of the time, what in our day-to-day practice, a patient comes with a low backache to my OPD for the first time, we generally will not be so aggressive and just go on investigate. We generally think it's more will be a muscular pain, and most of the times out of 195 it will be muscular with some anesthesia, analgesic medications, or some any like a muscle relaxant will help them to, or with some physiotherapy things will also help them to relieve of the pain. If the same patient comes with a recurrent pain and is saying that your medications are not helping, yes, it is a sign where we need to understand how to approach from is very important. See, for a basic investigations, what we do when a patient come to us is we generally go for an X-ray. That is basic. It gives us a gross idea what is happening, but X-ray only talks about the bony thing. It cannot give about the nerve compressions enta undi, a degree of disc bulge undi anadamu. X-ray cannot be difficult to explain. So there is something we are knowing that. So MRI will give us what is this disc basically, and the God is very creative in this earth. So if you take at this lumbar spine, generally when we talk, it is a more of a lumbar spine. In between the two vertebral things, there is something called, here you are seeing, I think, this is a grayish material that will be like a jelly. The jelly means it will be like a watery content will be there. Once you cross little age of 30-40s, the grayish, the water content goes down. So water content goes down, the jelly baru anta appudu a spongy nature goes down. So that when you put a sitting, and if you don't put in awkward positions and all those, you're working, when you are working
అంటే దాన్ని మళ్ళీ రీజనరేట్ చేయడానికి ఏమీ ఉండదు.
రీజనరేట్ చేయడం అనేది కొంచెం కష్టమే, బట్ వాట్ ఈస్ దట్ యూ కెన్ ప్రివెంట్. సో డీజనరేషన్ ఇస్ a nature. Now nowhere my age can come down. Age is always has to increase, it can never go down. Same way the spine also tells, it has to tell, no, I am also now 40. I am saying my age is 40, the spine tells, yes, the spine also have an age. So that
అంటే ఈ మధ్యన చెప్తున్నారు కదా సార్, సో పిఆర్పి ట్రీట్మెంట్స్ లైక్ అది రీజనరేట్ చేయడానికి అవుతుంది, సో ఇంజెక్షన్స్.
No, if you read, I saw an article in 2-3 days back only, Telangana some has published that there is no scientific evidence about all this PRPs.
Okay.
So you can just read, and it just comes in times also. So still we as such, we don't practice all then in our practice of all those PRPs and all those things.
Okay.
Generally what I tell my patient is cautiously being sitting on a chair. As I told you, sitting is always more dangerous than smoking. So if there is a rule say that 15 in 1, every 15 minutes make yourself and 1 minute to walk and go here and there and come back. So better to get going for a coffee rather than getting a coffee on a table is also a form of daily day-to-day caring your back. You have to take care of your back. Active spine is more important. So we do patients who come with persistent back pain. I told you radiological red flag signs. So we do an MRI. MRI is one of the basic investigations to understand degeneration. See, there is an n number of causes for the back pain, but in a day-to-day practice, what we are talking is more of a degenerative problems. Okay, so like if you keep aside of a degenerative problem, there is something called infectious undochu, spine tumors avvachu, spine lo TB infections, it is very common in Indian. So any spine fractures and spine tumor cancers, all are the one of the reasons which present like a back pain. But if you take in a practice, you don't find so often like a degenerative disc bulge, so what we call.
Yeah. సో లేడీస్ లో మోస్ట్లీ చూస్తే సార్, సి సెక్షన్ అయిన వాళ్ళలోనే బ్యాక్ పెయిన్ కంప్లైంట్ ఎక్కువ చెప్తూ ఉంటారు కదా, అసలు ఏమవుతుంది వాళ్ళకి?
అట్లా ఏం లేదు మేడం. బేసికలీ వాట్ ఇన్ మై డే టు డే ప్రాక్టీస్ ఐ సీ ఇస్ మోస్ట్ ఆఫ్ ద లేడీస్ వన్స్ దే ఆఫ్టర్ ద డెలివరీ దే స్టార్ట్ బ్లేమింగ్ దట్ నాకు ఎందులో ఇంజెక్షన్ ఇచ్చారు అప్పటి నుంచి నొప్పి అవుతుంది అని. కాదు, దెర్ ఇస్ నథింగ్ లైక్ ఇన్ సైంటిఫిక్ ఎవిడెన్సెస్ టు టాక్ అబౌట్ ఇట్. But the ladies lematosis, once the pregnancy goes, the spine curvature, which is a scoliosis, it becomes lordotic spine becomes little curvature change itself. That is the reason they go for little back pains, but nothing to do with this epidural injections what they get during their delivery times.
ఓకే. సో ఎటువంటి చికిత్స విధానాలు ప్రస్తుతం మనకి అందుబాటులోకి వచ్చేసారు? లేటెస్ట్ ట్రీట్మెంట్స్ ఏమున్నాయి?
It's very hour of the day, first thing I tell you is prevention is better than cure. If you take care of your back as you take care of your face, 90% of your problems are solved, but which we don't do in practice.
Of course.
Okay. And nowadays, sometimes I feel this, especially software group of people who work very hard with the system. Generally, if you come on a Saturday OPDs, most of them will be though only coming with back pain or a neck pain. So here, before we begin a treatment, better to have a prevention first. Take care of your back. Most of your problems are solved, because when you sit working for a system with the system, your postures go on changing, which you start putting so much pressure on your soreness develops, which you will not ignoring it. So that is one important thing. The second one is, as I told you, madam, for generally 95% of the times it will be a simple acute muscle spasm. You no need to have any X-ray or MRI also not generally required. It is not an what you call dictum, but most of the times you can just manually like muscle relaxants and some analgesics will help them to better. And those patients, sometimes the pain is so severe and they'll not, yes, we have a physiotherapy special thing. Physio team will help them in relieving the muscle spasms. We call them TENS therapy, where we give IFT therapies. We all this give them. There is ultrasonic therapy. These are non-invasive therapies where patients will very comfort with the muscle spasms goes down. If the patient persistent back pain, or there is like a leg radicular pain, we call leg pain, tingling sensation, urine issues, there is no wait for anything, you have to get one MRI. If MRI, based upon the severity of the MRI, what is there, we take a call. Most of there will be a disc bulging. What does disc bulging mean? I told you, this between there will be the water content goes down. Entire the story is water. Once it goes that, there will be what you can see the redness here, that will be a bulge. So what happens to this in this type is, I'll just show you one. This is what happens is you can see this one, right? These are the two vertebral bones. In between there is a bluish. So the what you see, we all know the bluish is water. So as the water content goes down, the pressure from the above causes the disc to bulge. So entire the patient start feeling the pain. This is what normally people call it as sciatica. Actually, sciatica is not. Sciatica is a nerve which begins much below. Because the nerve somewhat above is related to it, we generally use it as a sciatica. It's more of a misnomer rather than, it's not a sciatic problem actually. Okay. Once this disc is bulged, the patient complains. It's not every disc patient bulge, you'll have issues to be addressed. So this is what we show. It is based upon the degree of a disc bulge. If you see, there is nicely water, this one. There are two discs like nucleus pulposus and nucleus annulosus. So the two things what as the water content goes on, this starts bulging out. Once this is stage one like this, different stages. This is the nerve which is compressed. So once it compressed, the patient starts feeling the pain from this one. Okay. So generally, this is what we call as a disc herniation. So based upon the disc herniation in an MRI, and we correlate with the patient's findings, then we make a call what has to be intervened. Till practice, the dictum is 95 to 98% of my patients OP basis. Then comes the story, there are group of people who has to be addressed surgically. Surgery is always it's a big weapon. It should be used at the right time. All the patients cannot just need a surgery. And what if you say that in that also generally what I take in my practice, I make sure that there are 4 symptoms which I generally take into any significance in making a decision whether I'm going for a surgery or I'm going for a medical management. Generally, a patient who has a severe pain or who had a tingling sensation, this way I call them they are subjective symptoms. Patient kunna pain naaku nen tolerable cheyachu, పక్కన వాళ్ళు టాలరేట్ చేయలేదు. సో ఇట్ ఇస్ ద టాలరెన్స్ ఎబిలిటీ ఆఫ్ ద పేషెంట్ టు గో వెదర్ టు సర్జరీ ఆర్ నాట్. డిస్క్ ఉన్న వాళ్ళందరికీ సర్జరీ, దెర్ ఈస్ నాట్ ఎన్ ఆబ్జెక్టివ్ ఎవిడెన్స్. ఇట్ ఈస్ అ సబ్జెక్టివ్ యాజ్ అ రోల్. లైక్ పెయిన్ అంటే పారాస్థీషియా, టింగ్లింగ్ సెన్సేషన్, ముద్దుబారడం మనకు కనపడదు వాళ్ళ పెయిన్. కొన్ని మందికి డిస్క్ విల్ బి స్మాల్ బల్జ్ but their pain will be out proportion. Some people, the disc is too big, but you feel that they are completely on. So it's all about the patient's ability to tolerate the pain. So andike generally when they come, I use as a VAS score antam, visual analog score ani, out of from 0 to 10. How we generally ask them, what is your rate? Some tell 6, we see that okay, the disc on the is still 6. But there are some people with a very small disc, but they will have 10. So it is a patient's individual thing is very important in make a decision, like one is pain or other one is paresthesia. But at the same time, we cannot ignore other symptoms, something called motor weakness. Most of the patients, what we are discussing is more of a back pain things. So they come with the foot drops. అంటే చెప్పులు వేసుకుంటే పడిపోవడము, ఫుట్ ని వేసుకోలేకుండా ఉండే వాళ్ళు కూడా వస్తారు కామన్ గా. That we call it as a foot drop. Okay, not able to move the flap the foot. So such patients, always we tell them a surgical intervention may be benefit. Something in the worst and the is we find is something called cauda equina syndrome antam. They will have bilateral foot drops undadu and even urine retention, urine poyadaniki undadu. That patients, as early we operate, their prognosis is going to be better. So at the end of the day, as a clinician, is always to give better quality to the patient care. This is what once you decided for the patient whether we are going to operate, what we are going to operate, how we are going to operate depends upon. See, nowadays, as we begin with your statements, sir, there is a lot of advances that happened in the neurosurgery spine especially. So vast technology has grown up. See, initially we used to do with open my mouth, big incisions. Earlier, like in one small spine operated meant 10 centimeters incisions. Now a day has come to 1 millimeter incision. You don't see the incision on the back. Even they can, it has become more cosmetic than the cosmetic, you can say. So there is like in from micro we call laminectomy, discectomy, they are all like an old procedures. Now micro discectomy, which is also considered still golden standard procedure, but at the same time we have advanced next level to minimal invasive spines procedures, and now the endospine is one of the upcoming is come up. We do a small and the patient is all admitted in the morning and we discharge him in the night. This is the technology, and I take this as one of the bright opportunity for me to share my people that the spine myth has gone now. It's not like an earlier spine means అయిపోయింది, నాకు బెడ్ రిడన్ అయిపోయినాను, నేను ఇంకా నడవలేను అని. Those all the days have gone. Now that it is a golden days for a spine. Okay, so generally this is what we talk about the discectomy, endospine. We do spine procedures with very very small tiny incisions. We remove the only those part of the disc which is bulged out and make sure the nerve is made free. Okay, the patient can just lead a normal quality of life. Nowadays we are becoming slowly daycare procedures, means admit morning, send him in the night. But this,
సో ఆఫ్టర్ సర్జరీ తర్వాత వాళ్ళ రికవరీ టైం ఎలా ఉంటుంది, ఎప్పటికి నడవగలుగుతారు, ఎలా ఉంటుంది అంటే మినిమల్ ఇన్వేజివ్ సక్సెస్ రేట్ అనేది ఏ రకంగా ఉంది?
that is now I told you, you can openly tell in all your customer and viewers, spine does have only good golden days. Most of them out of 100, in my own experience of last 15 years, 99.9% I feel confident they're doing good, and people will, I expect I'll be continuing to provide my good services in that form. This what I spoke is more about the disc bulge, madam. But sometimes the patient will have a bone instability also. So there is a bone and there is a nerve. Both has to be addressed. Earlier people still feel that it is a more of bone problem. It's not like that. But the spine nerves are also issues, bone are also issue. Sometimes there is something called spondylolisthesis, we say. The spine is one bone will move like an other on the front. So then we consider it as an unstable spine, means the spine is not stable. So that we need to do something stabilization. We call them as a spine procedure. Fixation we call them. Means we put a rods and screws of those one and make the spine to mobile. So that the mobility is sometimes where there is a mobility, there is a damages chances more. In the same way, once you fix them, that also we can do with an open technique, or we can do with the minimal invasive spine technique, or we can do endospine fusion techniques where we just put the screws and rods and come out. It means the why this open techniques to minimal invasive technique is, see, both the in a long term results both are proved to be same. The only thing in the minimal invasive technique is that the minimal muscle damage, minimal blood loss to the patient, early mobility. These are the one of and the post operative pain, they generally are very very significantly considered the lower, very low level.
స్పైన్ సర్జరీ చేయించుకున్న ప్రతి ఒక్కరికి ఒక భయం అయితే ఉంటుంది. సో నా సెక్షువల్ లైఫ్ ఇక్కడతో అయిపోతుందేమో అనే భయం ఉంటుంది. సో ఎలా ఉంటుంది తర్వాత?
No, this is a question which I day to day practice very commonly understand. I don't think you need to worry about this. Your personal life is not affected in any way. whatever you are doing. Whenever we do any spine surgery, to make your life better, not to make your life just one, so your life will be much better. But yes, once you are a spine, we are, see, there will be 33 bone God has given it. You should be little careful when you are doing all those aggressive exercise, all those things. You should be under monitoring is very good.
సో ఆఫ్టర్ సర్జరీ తర్వాత ఎలాంటి ప్రికాషన్స్ తీసుకోవాలి ఇంకా?
So generally what I do, madam, in a spine patient is I generally on a for those cases where I put a little longer complex spine surgeries we do, we generally don't discharge on the day of the same day. Those complex procedures I try to discharge them on second or on third day. So I generally ask them to come back after 10 days for the to review. We generally make sure that they don't bend forwards and don't lift heavy weight for at least 3 months is a better option, I feel. But they can lead their personal normal quality of life.
జనరల్ ఎవరైనా స్పోర్ట్స్ పర్సన్స్ ఉండేటప్పుడు ఇలాంటి ఇష్యూస్ ఏమైనా వస్తే సో మళ్ళీ నార్మల్ గా వాళ్ళ ఆ స్పోర్ట్స్ అన్ని కూడా
You can. There is no doubt about it. And Virat Kohli also, I have a cervical spine. No, we don't need any other this wonderful player. I also love to watch his match. So he's, in spite of his neck issues, and he is working very hard. I think we can take him as one of his inspirations.
Right.
Even Bumrah also recently had some back pain. This is how the quality of life has never been affected. Neither no disturbances. It will be much better only. But I'd still always tell that 95 to 98% of the people don't need. You take care of your back, so most of your issues will be settled down.
థ్యాంక్ యూ సార్, థ్యాంక్ యూ సో మచ్. సో స్పైన్ ఇష్యూస్ అసలు ఏముంటాయి అండ్ నవ్ డేస్ మనకి ఎలాంటి ట్రీట్మెంట్స్ కూడా అవైలబుల్ ఉన్నాయి, సో ఈ విషయాలన్నీ కూడా తెలియజేసినందుకు థ్యాంక్ యూ సో మచ్.
Thank you. Thanks for this opportunity, madam.